Thank you, Madam Chair, and thank you very much, Minister, for being here today on this very important study on the mental health of young women and girls. And I think the fact that you are a federal dedicated minister just for mental health shows the incredible importance that our government puts on this issue of mental health. And I'd like to pick up on something that you said in your opening remarks about national standards for integrated youth services. You said that you gave an example about how this has the potential to be truly transformative. My understanding of it is that this is a way of combining community-based health and social services with online tools and resources and creating kind of a one-stop shop. I wonder if you could explain a little bit more about this and about where we're going with that.
What's exciting about it, Anita, is that really it began just 5 or 6 years ago with one stop in Van Gran and is now up to 25 sites. And it is the future because it's a stepped care model. People get the most appropriate care in the most appropriate place by the most appropriate provider at the most appropriate time. And one of the appropriate places is virtual. But as that young person walks in the door, they're greeted by a peer support person, somebody who with lived and living experience. They have a primary care provider. If they need a social worker, a psychologist, even an addiction medicine specialist, even virtually or online, need help with housing, need help with education, help getting a job. This is all, but it's uniquely wrapped around and it's integrated into the rest of the system. So if they've been to Emerge on Friday night, their primary care provider knows that. And so it is what we've got to do. And I have to say, Anita, as you know, our friend Dr. Karen Breek once said to me as the physician for the snowbird, she says, why don't the veterans have this? So I hope one day we'll be able to get that kind of wraparound supports for really everybody. But what also is exciting is this is 0 to 25 or 12 to 25. So it means that there's already a consensus that you can't let kids drop off the map at 18 in a pediatric setting, that this is right to 25, and it includes a lot of their challenges with post-secondary or other challenges that they're facing, including gender identity.
And one of the things that you just mentioned in terms of having social services and health supports and other kinds of supports, why is it important that when we're having this conversation, we're not just talking to mental health professionals, but we are talking to teachers, to social workers. We are talking about the peer support, that we engage everyone in a holistic way as opposed to sort of looking at it just piecemeal and just focusing in on the mental health and not on the whole person.
It's a really good question. I mean, a lot of the children with or youth with serious challenges may be in a group home. You actually have to have everyone who is able to help that young person thrive. And as we heard from the young woman last Tuesday in Van Gran, that this is family, and it is a place where it's safe, that people feel safe. But as we know, the medical model, I mean, Tommy Douglas said a long time ago, we shouldn't be waiting for people to get sick and then patch them up, which is the medicine wheel, keeping people in balance medically, mentally, physically, emotionally, and spiritually. And so this is an approach which is holistic and individualized care, and I think it's very exciting. It's also evidence-based. The CIHR is studying each of these, and I think that we'll be able to show how cost-effective it is too.
We've heard a lot in this committee about intersectionality and that people's differing identities impact significantly their mental health and whether or not they're having mental health crisis or get the supports that they need. You mentioned veterans earlier, but there's also, of course, another group of people in Canada which is under federal responsibility, which are Indigenous peoples. I wonder if you could tell us a little bit about the particular needs and crisis that is affecting Indigenous young women and girls, and some of the things that we're able to do about that as well.
Well, as you know, a lot of the the intergenerational trauma has had a terrible effect in terms of people, but without parenting, residential schools, but then, with children being apprehended and taken out of their language and culture. And so everything we're trying to do now is to make sure that if the mom needs some help, that there's someone in the community that can, the healthy auntie, a healthy grandparent that can wrap around the care while mom gets some help, or how we don't take that child out of the community. We also then know that as we that in the wonderful summit that Minister Haiju had in just after Parliament resumed, that in that Indigenous Mental Wellness Summit, it was inspiring to see all of these programs, Indigenous-led programs that people know are working. And so it's very important that we are supporting Indigenous ways of knowing and doing, and whether it's on the land, whether it's the importance of language and culture, all of those things, I think, and also the fact that within their school systems, it has to be led that way.
Thank you.